As a student aspiring to become a doctor, one of my main concerns about our medical future is antibiotic resistance. Have you ever popped double the dose of ibuprofen at the slightest sign of a headache? Or have you ever failed to finish the entire course of your antibiotics? Although these two practices are quite common, they can lead to resistance. Since I'm going to be on the front lines of this battle in the future, I want to start to make an effort, right now, in fighting antibiotic resistance in particular. Now you may ask, why has this become such a big problem all of a sudden? Well, actually, antibiotic resistance has been around since antibiotics were first introduced as a treatment option. But it is only recently that the problem has been starting to get out of hand, now being considered an official global concern by the World Health Organization. In regards to agriculture, which may seem insignificant and distant to us, but I promise you, it is anything but that. In the farming industry, antibiotics are used excessively for growth promotion and weight gain. A cause for concern is that this practice is utilized widely in low-income communities and still developing countries. So, how does this affect us? I'm sure almost everyone in this room consumes pork. Pigs that are raised in these conditions have traces of antibiotics embedded into their fat layer. To think the delicious fatty part of a steak someone may be having may be making them resistant to a life-saving medication. I first became intrigued by this topic from my research with Atai University. My research was on the efficacy or the effectiveness of the noni plant on Enterococcus faecalis, a bacteria. One of the more notorious aspects about this bacteria is that it is found in nosocomial infections, infections that are found in hospital environments. To think that even in seemingly sterile and clean environments like hospitals, this bacteria manages to survive and even thrive enough to infect patients and cause complications. To add insult to injury, Enterococcus faecalis is resistant to several antibiotics, ones I would choose not to mention in this talk because that would simply take too long. This resistance turns a simple routine surgery recovery into a debilitating process with risks of serious infection. One of my concerns that I've recognized is the contrast between some countries and the usage of antibiotics. While in some countries, physicians are more strict or tenacious in the prescription of antibiotics, while in other nations, antibiotics are prescribed pretty regularly, and some are even available to be purchased over the counter in certain pharmacies. The frequent and unregulated use of these antibiotics could be exacerbating the rate of antibiotic resistance in that particular region. Now, I'm sure your next question would be, how does this even affect me? Well, in hospitals, when a person comes in with a bacterial infection, the most standard approach of care would be to prescribe them an antibiotic. However, if that bacteria is antibiotic resistant, the treatment options for that infection would decrease exponentially, giving more time for the infection to spread and for more complications to arise. Now, imagine yourself on that patient bed. Your doctor is telling you, sympathetically, that you need to change out your long list of medications for the nth time for a new, equally long one in hopes of clearing out your infection. This repetitive, draining, and discouraging process is something I do not wish upon anyone. But sadly, this is the reality of some people living with these unrelenting infections. Basically, my goal in speaking today is to bring awareness to this silent, growing problem. So, tell your friends, tell your family, tell everyone. We need to bring awareness to this massive issue before it is too late. I don't want to imagine a world where a simple cut or scrape could imply serious complications or even death. And I'm sure you do not want that as well. Thank you.